wellness revolution starts now.
Hello, I'm Dr. Steve Hotze, and welcome to today's program. It's a privilege for me to have one of our guests, Blake Horelica, join us today to talk about his experience getting on the path of health and wellness by coming in here to the Hotze Health Wellness Center. Blake, glad to have you on board today, my friend.
Sir. Thank you for having me.
So you came in originally back in 2023.
That's right.
Just a little over 2 years ago. And what was going on in your life that made you're a healthy young guy, 36, 38 years old?
Just turned 40 in November.
Hey, congratulations.
Yeah.
Enjoy your youth while you have it, sir.
I'm trying to.
I remember when I used to think 40 was old. Wait till you get to be my age. 40 looks like a young man now.
Yeah, 30 wasn't so bad. 40 starts making make you think about some other things.
Right. So you married, got any kids?
Yes, sir. Married. I have 2 kids, a 10-year-old and a 7-year-old.
Oh, good.
They keep me busy.
Yeah, I bet they do. Boys, girls, what you got?
My oldest is a girl and youngest is a boy.
Good. Has you started athletics, baseball, or anything yet?
Oh, yeah, second week. So we got a busy week this week.
Oh,
Little
that's
League
good.
Baseball.
I coached Little League. I had 3 sons, and I coached Little League for years while they were in there. It was a great experience. So you're going to enjoy that.
We are, yeah.
And you look like you were an athlete yourself. So
High school football.
good. Where'd you play?
Brazos.
Yeah. So where are you from originally?
Wallace area.
Okay.
Yeah, so just about 15 miles west of here.
And then you moved to Houston, and what kind of work you in?
Well, I stayed in the Wallace area. I commute just up the road at Quiddity, and so they're back and forth every day. So I'm just right around the corner.
And so what do you do? What kind of work you in?
I'm in the surveying industry, civil industry.
Do you do surveying yourself, or do you?
More of the project management role.
Right.
Yeah. So that
You probably started surveying and moved up, I guess.
I did. I came in as a draftsman when I was 21 years old, and my take on it was I want to know what drafting. So that got me into the field quite a bit, and just eventually worked my way up into project management and just kind of keeping the ball rolling on a lot of stuff and making sure the trains run on time.
There you go. Okay, so what brought you into the Hotze Health and Wellness Center 2 years ago? What was going on in your life and your health that made a young guy like you come in?
It started a while back for me. Back in 2020, I had a very basic procedure on my arm for a minor rotator cuff tear. Everything went fine. Part of the procedure was to have a nerve block put in. After in rehab, I ended up having a bad reaction to the nerve block and went to the emergency room.
What kind of reaction?
I believe whatever was in the nerve block got too close to the bloodstream or into the bloodstream, caused pupil dilation and elevated heart rate. So I went to the emergency room, and they ended up putting me in stroke protocol. And it just kind of went from 0 to 100 instantaneously, and overall was a very bad traumatic experience for really a very minor issue. The result after everything ended up being that I could have just simply pulled the nerve block stent out at home, and that would have been that. But the mental damage had.
Where did they put the nerve block?
Up
in
here
your
in my neck. Yeah.
This was for left shoulder.
Left shoulder, yes.
And
So
then
just
you
to-
ended up having a right shoulder later here.
That's right. Yeah. So shortly thereafter, dealing with the emergency room issue, I ended up having a pretty severe panic attack. I didn't know how to deal with that. And I think that's where my anxiety was introduced into this. And I think with anxiety, for any individual that has it, it's kind of this mental game you play back and forth with yourself on how to deal with it. And if you don't know how to deal with it, that's where the problem. It makes things worse. Certainly. My solution was to go the medication route.
Okay, so you went and saw a physician about this. What kind of doctor did you see?
Just my local primary care physician.
And so what did he tell you? What did he do for you? What did he recommend?
I was on the standard regimen of anxiety medication, low dose of citalopram.
Celexa, which is an SSRI antidepressant. So he started you on that, and
everything was fairly okay. I wasn't at that point a big fan of getting on the medication, but again, I didn't know how to handle it, so that was my best alternative.
Right.
So I maintained that for about 18 months. Towards the end of that 18 months, I ended up getting off of it, and that then got me to my second procedure on my right arm.
What happened to your right arm?
Labrum issues.
Yeah, but how did that happen?
I guess I just got older. I noticed everything slowly.
Were you lifting weights?
No, nothing, no major sign of anything. It was just a slow onset of discomfort, especially at night if I would sleep on it.
Mm-hmm.
And there's clearly some issue with it, and had it looked at, and they ended up doing a procedure on it and fixing it up. Then after that, I ended up not being able to sleep that good at night. So I'd already gotten off the citalopram because I didn't
want to be on it any longer.
I didn't want to be on it any longer. But I wasn't sure if that ran parallel to my sleep issues. And my sleep issues consisted of almost every night I would have a hypnic jerk, and it messed up my sleep routine.
What do you mean you had a hypnic jerk? Explain that to me.
As soon as you fall into sleep, your body wakes you up, and
when you jerk up,
you jerk up. You know, if you ever have to equate it to kind of the dreams you'd have if you fall off your bike and you wake up, something like that. You wake up in a slight panic, and it just disrupts your whole sleep routine. And you have to start all over, and that would last for hours a night.
You'd have several episodes of that.
Several episodes every night.
And so you went to see a doctor about that, or saw your regular physician about that, and what did he recommend?
Well, it kind of became this revolving door of get back on the medication. It's mild jerks at night, and just supplement it with your citalopram. Try that again. And that's kind of where I got to the point of there.
So they put you on some clonazepam and in the Celexa or citalopram.
Yes.
So you were on two medications.
Yeah, one was for one was the maintenance medication, then one was the, I guess, isolated incidences for the clonazepam.
Right.
And so I had been doing this for 2 years, and I didn't really care for the routine that much. And it wasn't helping either.
What was your overall energy level like?
Well, naturally, you get horrible sleep. Your
energy level is low
the next day.
How about your mental sharpness?
I could maintain mental clarity. There were the occasional periods where I'd have mental fogginess just due to kind of being wiped out from the day before. And I think it was just this constant up and down of you get the sleep deprivation, you get to a point where you're so tired that you do get some sleep, and then it kind of starts all over again, and it's just a constant up and down cycle. And
so did you go back and talk to your physician about that?
I did multiple times.
And
I eventually
what did he say?
I eventually went to, at this point I was seeing a neurologist, and then we kind of went to this back and forth of I had a sleep study. Results came back as mild sleep apnea. I didn't feel that was too big of a contributing factor, but I'm trying to follow every doctor's advice at this point. while still maintaining the medication, and I just wasn't seeing any of the results.
Did you get on a CPAP machine?
I did.
Didn't seem to help.
No, it's on the side of my bed now. I haven't touched it in about 6 months.
Okay, so there you are. You're having these sleep problems that are affecting your overall energy level. How was your drive, directedness, assertiveness, sense of well-being, self-confidence, your mood, your goal orientation?
Well, I kind of wrapped that all up into that spiral of anxiety. It gets you wondering about what this issue is, what's causing it. Then it keeps you up at night, and it's just this spiral. So
downward kind of spiral.
Yeah, just a downward spiral of what's going on, and just how do I fix it? If I could just fix this one basic solution, everything else would go away.
All right. Okay, so how did you hear about us? What made you decide to come in here to the Hotze Health and Wellness Center?
I hear you all the time on 740.
Is that right? And so you finally said, something must have rung your bell. What was it? You remember what
Not being a big fan of the maintenance medications,
right. Pharmaceutical companies and all that.
That's where I considered and eventually got to the point of coming in and wanting to do more of a holistic and healthy type of routine.
Right, and so who did you meet with? Who was the physician? Did you meet
Dr. Ellsworth.
You met with Dr. Ellsworth. So when you came into what did you expect when you came into the Hotze Health and Wellness Center? How was it like or dissimilar than other doctors' offices you've been?
I didn't know what to expect. When I first pulled up, there was a staff member waiting downstairs to greet me to come inside for my initial visit. And then when you walk in, it's not the drab type of standard medical office.
With plastic chairs or metal chairs.
Exactly. There's a little bit of a comfort level, actually quite a bit of a comfort level when you come in. And then sitting down with Dr. Ellsworth was getting the experience that you have this blocked out level of time that you can go through your entire series of problems. And I think for anybody that's gone through the mainstream medical route, you probably have a block of about 15 minutes, 20 minutes at most, and then you're ushered out the door because they have more patients to see. Whereas here, your time is your time, and your physicians cater to you throughout that block. That was a big difference, is that they're there for you through that entire
it's interesting you bring that up, and I'm glad you mentioned that. We feel here we're a Christian-based ministry, and so we feel like we have a ministry of health towards our guests. We call our patients guests. When they come in, our goal is to help them get on that path of health and wellness so they can fulfill the purpose that God has for their life with serving Him, serving their families, serving their friends, serving their associates. Mm-hmm. We want to do everything we can to help you get up and on that path so we're your partners in your health. And that's why we want to listen, affirm what you have to say instead of going, well, why don't you just take an antidepressant and be on your way?
Exactly.
Or take an anti-anxiety drug. Let's see if we can get to the root of the problem. What's causing you to feel this way or to have these symptoms? Let's see if we can get at the root cause. If we can get at the root cause, then we can solve these problems and you're not going to need to be on all this medication. Mm-hmm. So obviously, Dr. Ellsworth, and he does a great job. He spent a great deal of time with you, right?
Oh, yeah. I think we met initially for about an hour and a half.
Yeah. Which had to be kind of surprising. You were probably thinking, when's he going to walk out?
No, I was very, very appreciative of the time spent there. Again, not knowing what to expect on my initial visit, but I've never spent that amount of time with a doctor in one place. Maybe in the facility once you're moved from one to the next, but not with the physicians themselves.
So I took a look at, I saw how his recommendations. He diagnosed you based upon your clinical presentation with needing some thyroid medication, needing some testosterone, some vitamins and minerals, some herbal nutrients to help you with stress. And I went back and looked at the blood work when it came back, and your vitamin D level was in the gutter. I mean, it was dead in the gutter, and it's come up a bit now. I still think you ought to be on more vitamin D, but it's in a much better level. You were below normal. I mean, 24, and the range is from 30 to 100, which are probably low ranges anyway, because most people they test are living inside most of the time. So probably the range should be much higher than that. Back in the old days when we're all outside working. But your vitamin D level was low, and your testosterone level was just flat out in the gutter. I mean, it was below normal for a 30 to 40-year-old. And the way the lab do their studies, they have a range for 20 to 30-year-olds, and they have 30 to 40, 40 to 50, 50 to 60, 60 to 70, 70 to 80. So a 30 to 40-year-old is going to have a lower average range than a 20 to 30-year-old, and you were below the range for the average 30 to 40-year-old, and you'd be, way below the range for a 20-year-old when your testosterone should have been at a peak.
So I need some help.
And testosterone, most people think of it, it's the male sex hormone, so they think of sex. But it's most important for your brain function, for your initiative, your assertiveness, sense of well-being, your self-confidence, your mood, your goal orientation, your drive, your directiveness, decisiveness, analytical ability. The hormones, both male and female, affect the neurotransmitters in our brains and the way we think. So when your testosterone level goes down like that, it's common to have anxiety, and you can have moods, depressed moods. You just don't know where you're going, or you lose the drive, and it's just like something's going on. What's going on? And the doctor says, well, you need an antidepressant. Well, nobody has those symptoms you have based upon the fact they have low levels of citalopram or Celexa or Klonopin, which is clonazepam. That's not the reason. You weren't born with that in your body, and those are drugs that try to mask symptoms. Why don't we get at the root cause? Well, the root cause, you had symptoms of low thyroid, although it doesn't show up on blood tests. Clinically, you did, and we always will give an empirical trial of thyroid if you got some of those symptoms. And we gave you a little bit. I think you're on a half a grain of thyroid. And then we put you on some testosterone. You're on testosterone cream.
Yes, sir.
And your blood level came, shot up, man. You gotta be feeling a whole lot different.
Oh, yeah. Yeah, Dr. Ellsworth said everything is on the up and up. Everything.
Well, how are you feeling? That's the real question. Even though your blood tests look much improved, I know that has to improve the way you feel. So how are you doing?
I still have probably, like everybody else, I put in 10, 11 hours a day and go home, and I'm still kind of white, but...
You're only working 10 or 11 hours?
Yeah. Yeah, that's it. Nothing too much. But, all in all, I feel excellent. Shortly after, probably by my 6-month follow-up, I was off of all of the pharmaceuticals. By probably 9 months, I was having really clear results on the sleep functions. And to this day, as of now, I don't have any issues with
Well, are you
sleep.
taking some melatonin, sleep formula, and a tranquil and all that? So we have some natural herbs and natural preparations that you can take to help you with your sleep. And a lot of people, they go to their doctor and they put you on sleep medication. You can get hooked on that. You put on antidepressants. They put them on clonazepam and all that stuff.
I researched it all, and
it's not good.
it didn't look too favorable.
No, it didn't. And you were look, I commend you, Blake, for taking charge of your health. And not only have you done well emotionally and mentally, and got your energy level back up and your drive, but you lost weight.
30 pounds.
That's tremendous. And so you got on we always recommend a good healthy eating, yeast-free eating program, which is basically a ketogenic eating program. And you got on that, You lost 30 pounds. You look great.
Still on it.
I am too.
I haven't strayed away from it. That was probably the biggest eye opener in the initial visit. Again, not knowing what to expect. I didn't really understand how that contributed to all the health factors until I stayed on it for quite a while, and I started noticing just various podcasts just throughout the daily routine, hearing the same sentiment
from other physicians.
From other physicians.
Yeah. Some of the health and wellness doctors, yeah.
Yes, the negative effects. And if this wasn't going out looking for it, this is just kind of being in a
open mind towards listening.
Maybe
to
a political podcast,
Yeah.
and it would come in into it, and sure enough, they're talking about the negative effects of sugar, the seed oils, and then all this stuff. 9 months ago, Dr. Ellsworth introduced me to, and so it seemed to be a trend.
Has he got you eating yogurt yet? Making your own yogurt?
I tried the yogurt. I still have some of it in the fridge. I did one round of the SIBO.
Yeah. The microbiome, that's the bacteria in your large intestine play a huge role in your health. You think of it, we're made of a whole series of pipes. You got your GI pipe from the mouth all the way out. You've got your blood pipes. You got your air pipes. And my dad used to tell me what a doctor, but he said, son, if you keep your pipes clean, you're going to be healthy.
That's right.
So, and part of being healthy is having good microbiome, good bacteria, healthy bacteria in your gut. And most Americans at some time or another have taken antibiotics, which can disrupt the microbiome, and you get overgrowth of yeast, and you get bad bacteria in your gut. And the bacteria can have adverse effect on your health. As a matter of fact, something that we are looking into now more closely is the study of parasites and how that affects people. I've done a deep dive on that here recently. I'm writing a book entitled Health Span, Living Long, Living Well. It's not your longevity, how long you live, but how well you live while you're alive. If you're alive, you want to, like you were at 38. And I mean, my gosh, your health span wasn't any good. So your health span ended sometime in your 30s. The average health span of people feeling well ends when they're about 64 on an average. Age lifespan somewhere around 78 or 79 years, longer than women, less than men. But in the health span, there are a lot of things that affect your health span. One of them is hormones, as you well know, thyroid hormones, sex hormones, good vitamin and minerals, your nutritional status, what you eat. There are other things that affect that. Your teeth. I don't know if you live in the country? You have any livestock?
Yes, sir.
Okay. What's the first thing a farmer or rancher, when he goes to buy livestock, what's the first thing he looks at?
Probably those teeth to see how they're...
Looks at the teeth. And that's something doctors don't do. We leave it to the dentist. I think probably I had to memorize the name of the teeth in anatomy class, but there was nothing after that about the oral hygiene or dental health. We didn't, and how it related to our overall health. And mercury amalgams need to be removed because you got mercury in your mouth. Mercury's toxic. Every time you bite down, it vaporizes. I got mine taken out 20 years ago. You can have root canals, cavitations where they pull out your wisdom teeth. 85% of the population have lost wisdom teeth, which can create cavitations in which bacteria breed, spread throughout your body. The same thing happens in the root canals, and you get periodontal infection in your gums. So those things, those bacteria can seed in your body, and they go to any organ and cause problems with the toxins. And so I like to say, when was the last time, if somebody has a heart problem, say they've got coronary artery disease, how many of you that have had coronary artery disease, when you saw your cardiologist, said, let me just check your teeth and see what you got going on in your teeth? It turns out the very bacteria that are in the root canal teeth or in the cavitations or in the gums, guess where they end up? In the plaques. Those same gram-negative bacteria end up there, and they cause the inflammation, which leads to coronary artery disease. But they never ask about that. They put a stent in. You're still left with the problem that's causing, it's a chronic
It's
problem.
never addressing the root of the problem.
Yeah, and so you got to find out what the root of the problem is, and that parasites can be can similarly cause problems. They can lead to cancer, and they can lead to a host of health problems. So I finished my book completely, 21 chapters, and then I've known about parasites, and something's been telling me for the last month or two, you got to write a chapter on parasites, and I'm thinking, no. So I spent about 8 or 10 hours reading on parasites this weekend, so I got to write another chapter.
Well, to give you one example of, in passing, finding these articles that Dr. Ellsworth had, similar to the information Dr. Ellsworth had touched on, just sitting in the lobby waiting to come up, I read an article about Coca-Cola looking into investing in the prebiotic drinks that I think are pretty heavy right now.
Yeah.
We have quite a bit of them at the household. We replaced it with all the sugary drinks.
Right.
And the kids love them. The second one was just to touch on, it was related to apple cider vinegar.
Right.
And the benefits of apple cider vinegar. And not that it's an end-all be-all, but this triangulation of the patient, the route that they want to go, and then the pharmaceutical side of it, kind of a trust but verify. And some of these things may work for you, but just to touch on the notion of not going down the pharmaceuticals as a first route, and that some things are there's options out there.
There are other options, natural approaches to health. Blake, I like to say this: God has given your body amazing restorative power. If you put the right molecules in your body's going to be healthy. You put the wrong molecules in your body's going to be unhealthy. And a lot of the wrong molecules are the drugs that people end up putting in their body. Mm-hmm. You came in on 2 drugs in your 30s. We have people coming in their 60s and 70s on 6 and 8 and 10 drugs. Mm-hmm. You can't believe it, on everything. And nobody's sick because they have low level of drugs in their body. They're sick. They have underlying causes that have to be addressed. So that's what we like to do here. And I really commend you for taking charge of your health. Folks, I like to say this: the only person in charge of your health is you. It's not your spouse. It's not your doctor. It's not your insurance company. It's not the government. There's only one person that can ensure you get healthy, and that's you. And you need to find like-minded people that look at natural ways for you to improve your health so they can help you onto the path of health and wellness, just like Blake has done. And he's a great example of someone who took charge of his health and has got his health back. And that's really commendable. And that can be done by anybody, but it takes personal discipline.
Yes, sir.
I like to say, we're the health coaches, you're the health athlete. You're in the health Olympics, we want you to win a gold medal. You got a gold medal. Congratulations.
Yes, sir. Thank you very much.
That's great. Well, if any of you would like to get on that path of health and wellness too, so you have energy, vitality, and enthusiasm for life as you mature, just feel free to give us a call here at the Hotze Health Wellness Center. We'll have a new guest consultant visit with you and get you in and help you and work with you and minister to you, really, to help you get up and running well, toned up, so you have an enjoyable, healthy, productive life. Thanks so much for joining us today, and thank you, Blake, for being our guest.
You're very welcome.
Okay, buddy.
At Physicians Preference Pharmacy, we understand that the quality of your compounded medications directly affects the way you feel, which is why we believe that your pharmacy should specialize in compounding medications while also delivering extraordinary hospitality and guest service. We believe that both patients and prescribers should accept nothing less than consistency and quality from their compounding pharmacy. This is why we've implemented some of the strictest quality standards in compounding, exceeding standard requirements, achieving PCAB accreditation, which is the Pharmacy Compounding Accreditation Board, an organization that sets the highest standards in compounding pharmacy regarding the safety, cleanliness, and quality of your compounded prescriptions. Because of our commitment to complete health and wellness, we are dedicated to making your medications free of lactose, parabens, artificial sweeteners, and any unnecessary dyes, binders, or fillers present in many other medications, offering you the cleanest products possible.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.